It's called a lobotomy. It's that nice young doctor's specialty. He bores holes into the skull and operates on the brain.
Dr. Walter Freeman, known as the Icepick Surgeon, would become infamous for performing up to 25 lobotomies in a single day.
He eventually developed a way to do 2 at once, one with each hand at the same time.
A pick-like instrument was forced through the back of the eye socket to pierce the thin bone separating it from the frontal lobes.
With a hammer, tap through the brain, wiggle it about, sever the frontal lobes, withdraw it.
This icepick lobotomy could be performed in under 10 minutes without anesthesia. It allowed him to perform up to 25 lobotomies a day, often attracting attention from reporters.
Miracle cure to the brain. Cutting the brain cures the soul. The media was all over it.
He would present before and after close-ups of patient faces as evidence of the surgery's success, when really the reality was much more bleak, with patients becoming emotionally numb and physically docile.
When they brought her home, she did not know how to do the activities of daily living, even the most basic things like toileting and bathing.
Freeman, equal parts physician and showman, became the face of the procedure. He traveled in his lobotomobile to 55 psychiatric hospitals across the country, performing and teaching the lobotomy. Over 4 decades, Freeman performed nearly 3,500 lobotomies, despite lacking surgical training.
I thought he was the nearest thing to a genius that I had ever met. I also thought he was crazy as hell.
Freeman performed the first lobotomy in the United States in 1936.
He wanted to solve the problem of psychiatry, and he wanted to do it fast.
Initially, he conducted lobotomies as full-scale surgeries involving neurosurgeons. However, driven by his ambition to clear mental asylums quickly, he devised a more efficient method using an ice pick from his kitchen drawer. Freeman traveled, touring hospitals and mental institutions across the country with his ice pick and hammer. He performed ice pick lobotomies for various conditions, even headaches, with cases of him performing the procedure preventatively.
Freeman recommended a front-lobar lobotomy in order to change my behavior. I was 12 years old.
Eventually, he began operating from his van, which people later dubbed the Lobotomobile. His reckless approach, including operating on teenagers and children, resulted in irreversible damage to many patients.
There was a number of children who received lobotomies at Freeman's hands.
Rosemary Kennedy, sister to JFK, became one of Freeman's most famous patients.
And they asked her to sing songs and recite poems, and then when she stopped talking, they realized they had gone too far.
Her lobotomy, sought by her father to control her behavior, left her with severe impairments from which she never recovered.
It left her incapacitated, unable to speak, unable to walk.
Freeman eventually retired the Lobotomobile and opened a private practice in California, never losing his license to practice medicine. Freeman continued to advocate for lobotomies, insisting they were the most humane approach. The lobotomy eventually faced criticism from the medical community, leading to its ban in several countries by the 1970s.